Okay, we're in Athens, Greece. I'm John Kanellopoulos, Medical Director here at the Laser Vision Ambulatory Surgery Center and Clinical Professor of ophthalmology at NYU Medical School. We have the pleasure of having a friend now visiting us from Europe, from Belgium in particular, and Ben has been very brave. We've been in correspondence. He has keratoconus. We saw him yesterday. We assessed all the elements. And we're going to have some frank conversation with him on what the difficulties of the procedure was, how he perceived his trip here and the actual procedure that we performed last night. Mm-hmm. So Ben, welcome you again today.
Thank you.
How do you feel?
I'm feeling great. I'm really happy because the results are already crazy. It's been 12 hours, I think,
yes,
from the surgery, and it's already, whoa. I cannot describe how crazy the left eye has been improved.
It's very impressive. How long have you, you obviously have advanced keratoconus on the left eye. How long have you known that the left eye is not seeing well?
I think it's been 7 years. So 7 years ago, I discovered this. I remember I was shaving here and I was like, why is it blurry on this? And then I went to an ophthalmology clinic.
Obviously, you stopped shaving since then.
And so I went doing examination in an ophthalmology clinic, and they made like 3 hours of examination, and they didn't discover what it was.
Okay.
So I was really disappointed, and I was like, what can I do? I don't know. They ended telling me, oh, there are tons of people with a unique disease and maybe it's this. And so I was not satisfied, but I didn't really know what to do. Years passed, and talking with friends, and the mother of a friend of mine, she had problem with eyes too, and she told me in this hospital in Belgium, they have the best specialist of the country.
Okay.
So maybe you should go there. And,
okay, good.
And this was 3 years ago.
3 years.
So 3 years ago, I went there, and they discovered that I had keratoconus.
And you were obviously offered the option to wear a contact lens on the left eye, and were you able to do that?
Not really. What they suggested to me was doing cross-linking on both eyes directly.
Okay.
So, but for me, it was a fresh news, and it was difficult to say just okay. And so I did my own research following that discovery. And
how'd you find us?
During those researches,
so
I felt like, oh, keratoconus is not like very clear. There are many people saying many different things about it, and I felt like, okay, I have to understand more about it. So I made my own researches. I ended up understanding that maybe it was directly caused by the physical
properties of the cornea.
Yeah, so I was like, I should really stop touching my eyes.
Okay, good.
And that was the main idea after my researches. But sadly, 1 year after that, I already see that it decreased. I mean, the
vision got worse and worse.
Yeah, it was becoming worse and worse.
How, in your daily life, work and fun, how is it difficult? Describe what is it that you couldn't do anymore until last evening that was, for you, disappointing?
I think there are many things. One is doing sports, for instance.
Okay.
Yes, of course.
What's your favorite sport? What do you like to do?
Oh, I like playing football with my friends. I like playing badminton.
Okay.
So yeah, of course, it's been worse. Something that is very awkward is like not recognizing someone's face from a distance.
That's very important.
Yeah, it's really awkward, and this is something that affects me. Of course, driving is something that I couldn't consider anymore because I'm really already scared about this.
Really?
Yeah, I think it's. I mean, before even having this, I already pay a lot of attention to safety nets and
Good.
So with this, it was if not.
So you weren't able to drive. Was there a difference between your attempt driving during the daytime and the nighttime?
Yeah, of course, nighttime is the worst because the lights are I don't know about multiple.
Exactly. The pupil, when we go to darker conditions, the pupil from our eye dilates to be able to function in lower light conditions, and this makes keratoconus much more evident. And you don't know anybody in your family that has keratoconus.
No.
So this was news for you. You never knew that this existed.
Yeah.
This is true about most people. So you researched and you found out there's a center in Athens. I mean, there's a lot of centers of excellence in Belgium as well and other parts of Europe. What made you say, I'm going to go to Athens?
So during my research, I've seen that cross-linking was available in many countries and in Belgium, of course, but all what they are offering is the stabilization of the process, I mean the disease. And I was like, okay, but my left eye is in bad condition. Is there a possibility to gain something back from it? And that's led me to Athens protocol that is offering this solution to this and saying, okay, you might gain something back and we stabilize it as well, of course, and having those double,
right, but the both benefits.
Yeah, the both benefits really, led me to think about it and say, okay, no, I will not do it in Belgium. I will make sure I make the money aside to make to.
Okay, that's a brave move.
Yeah, I think so.
Leave friends, family, and travel. I mean, Belgium is not far away, but it's far away if you think that you're out here on your own. And we see a lot of times people that come from other countries in Europe, even from the US. And we've had patients come from China and Australia.
Yeah,
so we're familiar with this. And a core thing besides us offering the best possible care is to make sure that you feel comfortable amongst our team. You feel like you're back home. Were we able to address that?
Yes, completely. Since I arrived, I've been really welcomed very well. Everyone is taking care of me.
Excellent.
So
you're moving to Greece now?
Yeah. Right now, and the friends that came with me, they are in love with Athens. So right now,
excellent.
And so I'm really happy. But of course, the main focus for me was the results of the surgery. And right now, I'm seeing the benefits. And
so you're ready within the next day, seeing better, and you're functioning better.
Yeah, it's already there. I mean,
that's excellent.
It's crazy. Yeah,
that's excellent.
I'm really impressed. I didn't expect as much as this, to be honest.
That's excellent. And did you feel any pain during the procedure or after the procedure?
So during the procedure, not really pain. It was just like a tickle or something.
Okay.
And during the first part of the night, I felt like no pain is not really but tickles, and it's
some burning
annoying
sensation or foreign body, like you have sand in the eyes.
No, I wouldn't say foreign body, but slight burning.
Okay, some light burning.
But and I woke up in the middle of the night, and the pain was disappeared. To be honest,
that's great.
It was really already good. So
excellent.
No, I didn't feel anything
good
particular.
So you can go back, enjoy Athens with your friends, and we'll see you, of course, this week and make sure that everything's at par.
Thank you very much.
Thank you. I think.
Thank you. Thank you, doctor. Really, I think you changed my life, to be honest, because in my job, I'm a software engineer and working on screens and coding every day.
Wow.
I need my eyes to be available for this.
That's a challenging job.
Yeah, and I'm young. I have many things to do, so
absolutely.
That was something in my mind, thinking, and now it's past, and I can focus on my projects. And
excellent. And we hope things get even better. And of course, we'll always be here, and we'll work with any doctor that you see in back home to work with them and make sure you get the best possible care.
Thank you. Thank you very much, Dr.
Thank you, Ben. Thank you so much. Do you have a message for someone that's in your shoes that has keratoconus? Obviously, what would be your message to them?
This is trustful. I mean, you can come here. They are the best of the best, and this is not even a question. You just need researchers, of course. Do not trust blindly, but if you do your researches, you will see that here we have the best people who really dig deep into that disease and find out solutions that sadly doesn't exist everywhere.
True. That's true. So, we're hoping that more and more colleagues
this
will
is also a message I would like to bring, is that I think, honestly, more specialists all around the world should focus on what's happening here, because it's not really normal that big countries, okay, maybe Belgium is a small country, but not France, not England, how do the specialists there are not already providing Athens protocol is a bit weird to me. Maybe, of course, I'm not an expert, so maybe they have reasons, but I'm still surprised.
We're happy to report that it's changing slowly. Of course, we're ahead, not just because it's the focus of our work and our research, just because we have much more keratoconus in our area. So that really makes us work more and gain more experience.
That's interesting. Okay.
But we'll be here and we'll take good care of you. Sure. And thanks so much. Congratulations again.
Thank you. Thank you very much. Thank you, Doctor.
Excellent, then. Excellent.